Well, I know it's something you've been talking about for years and you're passionate about that connection. So give us the lay of the land in a general sense when changes happen in the gut, how that impacts the brain.
Well, gut changes induce permeability or leakiness of the gut wall. When we mess with the gut bacteria and put them out of balance and reduce their diversity, then they can't do what they need to do. And the gut bacteria don't do a whole heck of a lot of things for us, but the things that they do for us are of fundamental importance for our existence. What do? Well, they create various vitamins, B vitamins. They help create our neurotransmitters, allowing the brain to work. And they create chemicals called short-chain fatty acids that do a lot of wonderful things around the body. They go to the brain and influence even how our DNA is expressed in the brain, especially one called butyrate. So we really depend on our gut bacteria to keep us alive. Again, the most fundamental thing that they do, or one of the most fundamental things, is maintaining the integrity of the gut wall. So when we are overdoing our non-steroidal anti-inflammatory drugs like ibuprofen, or taking an acid-blocking drug because we think we need it for our heartburn, or taking antibiotics when we don't need them, or eating a diet that's high in ultra-processed foods and is devoid of dietary fiber, for example, that would otherwise have nurtured our gut bacterial friends who want nothing more than for us to survive, because that's how they survive. Then we set the stage for these issues whereby the gut lining becomes more permeable. So things get from the gut into the rest of the body. And when they go through the gut lining, they stimulate receptors that turn on the production of inflammatory cytokines. These inflammatory cytokines, as mentioned earlier, make their way to the brain and can get through this blood-brain barrier. And guess who's right there adjacent to the blood-brain barrier, waiting to see what the heck's going on in the environment? You guessed it, the microglial cells. First thing you know, they see these inflammatory cytokines. They say there's trouble. We're going to shift into defense mode and shift to the M1 phenotype. That's good in an acute infection. But chronically having that happen, chronically having elevated inflammatory cytokines in our bodies, as is what happens with obesity and diabetes and leaky gut or inflammation from any cause, they shift to becoming brain destructive as opposed to brain defensive, and it sets the stage for bad things to happen to the brain. This is this incredible connection then between what's going on in the gut and what's going on in the brain. I did not know this when I wrote Brainmaker. When I wrote the book, the first book out for public use, consumption, that related the gut to the brain, the gut-brain connection. Didn't know it back then. So this, really supplies that corner piece of the jigsaw puzzle that you've been waiting to put in, that really ties together the two sides. And it's very exciting because, yeah, it's great to understand it. And one less thing for me to worry about and be concerned about how it works, but how empowering it is that we now can recognize that when we change people's diets and reestablish gut health, we're going a long way to improving their whole body milieu as it relates to ultimately the brain.
You brought up something really important there when you said cytokines are going through the blood-brain barrier and activating the M1. We've been shitting on M1 throughout the conversation, but they do have a role when it comes to acute.
That's right.
So I'm glad you brought that in because they're not all bad. It's when we chronically
exactly
convert
right.
the M2 to M1.
So we would expect in the case of head trauma or a stroke or infection that we want our M2 to shift to M1 to do the immune-related kinds of cleanups that they would do. But when the fire is out, the firemen need to leave. We don't need them anymore. They're in the way. And it's that shift back that leads to problems. Let me give you an example. If you look at large data sets of individuals who experience head trauma, There's a much worse outcome in individuals who experience head trauma who also happen to be type 2 diabetic, because they've already shifted a lot of their microglial cells over to being M1 to start off with. And number two, it's far more difficult for them to shift back to being M2 supportive after the trauma event. So they stay in the hospital longer, and their degree of neurologic compromise is worse in comparison to non-diabetics. So, that shows you that, yeah, there's a time and a place for us to have M1. I mean, it doesn't happen that way, just so that we can develop these therapies. There's a role for M1, that's for sure. There's a role for M1 macrophages in our periphery. We have the same M2 and M1 kind of dichotomy in the immune cells, some of the immune cells in the rest of our body as well. They shift to M1 when they're needed, and they go back to M2 when they're not. They go back to the firehouse, and they do maintenance work on the fire engine, right? That's what they're doing. They go back to M2 in the brain, and they're taking care of our neurons, taking care of our synapses, shoring up the blood-brain barrier. But it's this inability of them to shift back to M2 that is the reason that people, for example, with diabetes, they have a stroke, they're going to have a worse outcome. They have head trauma, worse outcome.
As you bring up these comorbidities, important we highlight here, we've been talking about it from isolated different variables, the M2 going to M1, but you could stack on, and you're sharing here, diabetes and head trauma. It becomes a lot more complicated when we start bringing in multiple variables in a negative way for the person, whether it be inflammation, metabolic dysfunction, all these different variables that can compound, and it's not as clean as we've been making it out to be.
Well, it's certainly not clean, but with all due respect, I'm going to say that the fact that there are multiple variables is empowering, because it says to that individual, there's a lot you can do. I mean, if you said, look, if you get your blood sugar under control, that's about the best we can do. No, it's not. You're right, there are a lot of inroads to microglial polarization, like lack of restorative sleep, not having enough exercise, not socializing, exposure to PM 2.5 particles in the air that you breathe, wearing a helmet or not when you ride your bike, getting your weight down to where it needs to be. There are a multitude of things, and unique sets of supplements that target the mitochondria within the microglial cells. It helps keep them in M1. But you are correct. There are many, and some would say, oh, that's just confusing and daunting. I look at it as having greater opportunity.
Yeah, no, I agree with that part. It's just the fact that it is more complex than looking at one variable at a time.
Definitely complex, but we're going to eat this one bite at a time. And if I could get an individual to say, hey, it's really a lot and I'm overwhelmed, my response is, let's do one thing today. Let's see what we can do to get you to get a little bit more exercise. You're not getting any right now. How about you walk? Oh, I can't walk very far. Okay. How about you walk to the mailbox at the end of your driveway and back twice a day? Oh, I can do that. Great. We have started. We've started the program. I am so encouraged when that patient says, yeah, I can do that. Because next time we can layer the next step on. Okay, we're going to get you an Apple Watch or an Oura Ring or a Fitbit, whatever it may be. And we're going to start to see how well you're sleeping and how long you're sleeping and what is the quality of your sleep. Oh, I don't know about that. Let's just try it. And let me send me a screenshot of your phone after a week, and let's take a look at what's going on, and let's see then what we can do to improve that. Well, I guess I could probably do that. Maybe I'll just do it once or twice a week. Fine. And then we'll get sleep to, 8.5 hours a night with good deep sleep for activating that lymphatic system and all the things. The patient's not waking up as often. We've taken care of some things. We've worked on sleep hygiene, making the room colder and darker, and caffeine curfew at 2 p.m., no more coffee after 2, getting off the computer a little bit earlier, getting some exercise during the day, all the things we need to do to get you to sleep better. That's targeting your brain. We're going to layer that on to the fact that you're now walking to the mailbox twice a day. Next time around, let's start thinking about, well, your blood sugar is 130. We can do better than that. And, doing all the things that help us bring that blood sugar under control. And it might mean medication. It's a big toolbox. We do what we got to do. And we got to get these things reined in. And I totally understand that, throwing the book at somebody right off the bat is compelling and daunting. But every journey does begin with the first step.
You made it to the end of this clip, which means you're gonna love the full episode. Head on over here to watch, and I'll see you over there.
These are the cells called the microglial cells that are taking the front of the stage now, because when they go south, it sets the stage for every type of brain degenerative condition that you could think of. When our blood sugar is elevated.